Hi, I'm Dr. Kelly.
And I'm Dr. Jane from Kids Smiles Pediatric Dentistry. Today, we're gonna walk you through what to expect and what to do at home for your child after a laser frenectomy, also known as a lip and tongue tie release done here at our office. Our main goal is for your child to heal successfully and for you to feel comfortable with their post-operative care routine.
Here's what to expect following completion of the procedure. You will notice a white or yellowish patch where the procedure was done. This is normal healing tissue and is not an infection. The white yellowish area is just what a scab looks like in the mouth. That tissue will slop and bright new tissue will appear. Once that tissue has integrated to a uniform color, that has healed. Mild swelling or tenderness is common for the first few days. Slight fussiness, especially with infants, is common and usually gets better after 24 hours. Due to the minimally invasive nature of the laser, most children do very well and recover quickly.
Next is managing any post-operative discomfort. Any discomfort is typically mild and improves within 24 to 48 hours. If needed, use Tylenol or Motrin as directed for your child's age and weight on the packaging and by your healthcare provider for the first day. Our website also provides instructions on how to make a homeopathic mixture using arnica, which can be massaged into the wound area to help with your child's discomfort. Cold breast milk, a chilled, not frozen teether, or a cold compress for older children can also help soothe the area.
Next, stretching and massaging the wound is a very, very important part for the success of the procedure. Even the most well-done release can meet a roadblock if not stretched well. Stretching the wound area prevents reattachment of the released tissue, which helps to achieve a full range of motion and support proper feeding and speech development. It is recommended to stretch these areas 4 times a day for 4 weeks, or as directed by your therapist if you are continuing under their care.
Today we will show you the stretches here on this lovely little boy. We will start with the upper lip, lift it and flange it all the way. Now massage right on the wound site for about 5 seconds. Not too hard, just firm pressure where the tissue blanches. Now for the tongue, hold the lower gum pad with your non-dominant thumb. With your dominant finger, push down beneath the tongue and stroke backwards right on the diamond. Gentle but firm, make sure to get all the way in there. Stroke backwards and hold for about 5 seconds. It is okay if the wound bleeds a little bit. That doesn't mean you're doing it too hard. You're just returning the wound to its original release position. If cheek ties were released, go up to the fold, firmly run your finger over the wound area for a few seconds.
Most babies will not enjoy having the stretches done, but this part is essential for proper healing, so do the best you can. We often say to time the stretches before feedings so they get a treat for getting the stretches done. For toddlers or kiddos with teeth, have them lean back into your lap for a better vantage point to complete these same stretches. Parents often find it helpful to have an aid in keeping their mouths open, such as a silicone block or a molt prop seen here. Links to these can be found on our website.
Immediately following the procedure, you may feed your baby normally, no restrictions. For older children, stick to soft, cool foods for the first 24 hours and avoid spicy or acidic foods for a few days. Normal activity is fine. Please contact our office if you notice bleeding that doesn't stop with gentle pressure, fever over 101 degrees, refusal to eat for an extended period, or if you have any concerns at all.
Thank you so much for allowing us to care for your family. We love helping you meet your wellness goals and are here to support you through the healing process. Thank you for trusting us with your child's care. We're so proud of them today.